Hello everyone! Our video presentation today is about first aid training and basic life support. Before that, what is first aid training? First aid training means which a person reacts and perform simple emergency medical care procedures before emergency medical professionals are available and necessary. There are 3 P of first aid aims. The first P is to preserve life. This is the main aim of first aid, to save life. This includes the first aider, the casualties, and the bystanders. The second P is to prevent further harm. This may include moving the patient out of harm, applying the first aid technique to keep him or her warm and dry. The last P is to promote recovery. This may include applying a plaster to a small wound and anything that may help in the recovering process. These are the characteristics of a good first aider. First, gentle, should not cause pain. Second, resourceful, should make the best use of things at hand. Third, observant, should notice all signs. Fourth, tactful, should not alarm the victim. Fifth, emphatic, should be comforting. And the last is respectable, should maintain the professional and caring attitude. How to deal with injuries. First, treatment of wound. Wound is usually treated by bandaging. Second, locate the wound position. Wound in a different location demands a different treatment. Therefore, it is important when the victim is still conscious and not to move a lot and remain in a sitting or standing position. The head should be in the highest part. Third, pay attention to the body anatomical shape. During the treatment of the wound, the body anatomy has to be noticed because it will affect the bandaging method. 4. Identify the size of the wound. The size of the wound determines the treatment method even though it follows the same principle, cover the wound and stop the bleeding. This is how bleeding wound treatment on the round body part. Determine the wound needs a pressing tool or not. If considered necessary, apply a pressing tool. Prepare an already folded bandage. Start binding from the wound. Binding around the head in circles upon arriving opposite of the wound or cross the bandage. After crossing, tie the bandage in the shape of parcel until arriving at the position of the wound. If the wound exists in the chin or upper head, a triangular cloth is needed to prevent the bandage from coming off. Tie another pair of string to the direction of behind the head via below the ears and make sure the bandage is not too loose.